What do breast cancer pathology reports show? Imagine trying to solve a complex puzzle about a breast cancer diagnosis. Pathology reports are like the detailed clues that help doctors understand exactly what kind of cancer they're dealing with. These reports are created by specialized doctors called pathologists who examine tissue samples under a microscope. They're essential for guiding treatment decisions and predicting how the disease might progress. So, what do these reports actually include? Let's break it down step by step. First, every report begins with basic information about the patient. This includes the patient's name, date of birth, and medical record number. It also lists the doctor who ordered the test and important dates, like when the tissue was collected and processed. This helps keep everything organized and accurate. Next, the report describes the tissue sample itself. Usually, this tissue comes from a biopsy or surgery. The report notes where in the breast the sample was taken from, such as the right or left breast or a specific area. It also describes the size and appearance of the tissue, both with the naked and under the microscope. This is called the gross description. The report then summarizes the patient's medical history and why the biopsy or surgery was performed. This context helps the pathologist interpret what they see under the microscope. It's like giving background to better understand the puzzle pieces. The core of the report is the microscopic findings. Here, the pathologist examines the tissue closely. They determine whether the cancer is non-invasive, meaning it is confined to the milk ducts or lobules, or invasive, meaning it has spread into the surrounding breast tissue. Common types include ductal carcinoma in situ, which is non-invasive, and invasive ductal or lobular carcinoma. They also assess how abnormal the cancer cells look, called the tumor grade. Grades range from 1 to 3, with higher grades indicating more aggressive cancer. The size of the tumor is measured, which is important for staging and deciding on treatment. The report also indicates whether cancer has spread to nearby lymph nodes if they were removed. This helps determine if the cancer has started to spread beyond the breast. The status of the margins is checked too. Clear margins mean no cancer cells are at the edge of the removed tissue, suggesting all the cancer was likely removed. If cancer cells are found at the edges, it may mean more surgery is needed. Another important aspect is lymphovascular invasion, which notes whether cancer cells are present in the blood or lymph vessels within the breast tissue. This can influence the risk of spread. Modern pathology reports also include biomarker testing. These tests look for specific proteins on the cancer cells, which can guide targeted treatments. For example, the report states whether the cancer has receptors for hormones like estrogen and progesterone. If these are positive, hormone therapy might be effective. It also tests for HER2, a protein that can promote cancer growth. If the cancer is HER2 positive, targeted therapies may be used to treat it. Some reports include other markers, like Ki67, which indicates how quickly the cancer cells are dividing. The report contributes to staging the cancer, which describes how far it has spread. Staging uses the TNM system, where T refers to the size and extent of the primary tumor, N indicates whether lymph nodes are involved, and M shows if the cancer has metastasized to distant parts of the body. Finally, the report ends with a summary diagnosis that includes the type, grade, stage, and biomarker results. This comprehensive information helps the healthcare team develop a personalized treatment plan. It also provides insight into prognosis and the likelihood of recurrence. Understanding your pathology report is a key step in managing breast cancer. It helps you and your medical team make informed decisions about treatment options like surgery, radiation, chemotherapy, hormone therapy, or targeted treatments. Always remember to discuss your report with your doctor, who can explain any terms or findings that might seem confusing. Each person's cancer is unique, and treatment plans are tailored accordingly. Pathology reports are detailed and technical, but they are vital tools in understanding and fighting breast cancer. Always seek guidance from qualified healthcare professionals to interpret these findings and plan your care.